Hey everybody, welcome to my channel, or welcome back if you're returning. My name's Sarah Beth and this is Sarah Beth Vlogs. Today's video, I'm going to be sharing my mommy makeover journey with you. Before I get into my journey, I'm going to share a little backstory with you. I'm going to link in the description box below some of my previous videos to catch you up so that I don't have to give a ton of my backstory and you guys kind of understand where we're at. So I'm 37 years old, I'm 5'10", and my current weight is 160 pounds. I was obese the majority of my adult life, and 5 years ago I started a low-carb journey and I was able to lose and maintain a 60-pound weight loss. So I started out at 220 pounds and I am currently 160 and I feel like a brand new person. My weight loss, combined with the fact that I have two beautiful children and this wonderful body that I've been blessed with, was able to carry and deliver and breastfeed two beautiful girls that are 12 and 6 years old. Mommy needed some help after losing my weight. 4 years ago, I reached my weight loss goal and decided that I wanted to have cosmetic surgery. So at the time, the full mommy makeover wasn't exactly in my radar. I wasn't thinking about the top and bottom surgery. So a mommy makeover, if you don't know, is a breast surgery combined with removing skin from your abdomen and having a tummy tuck. So some women that have a mommy makeover, they just have implants and then a lipoabdominoplasty or a tummy tuck on their abdomen and such. For me, with the weight loss and the fact that I breastfed for 29 months, my breasts were very deflated. They were sagging and droopy and had not much volume. Before I get into all of the specifics about me, let me tell you what my career is, because I have a really unique perspective that I'm hoping to share with you. I am a certified surgical technologist. I have worked ophthalmic surgery, which is eyes. I have worked OBGYN and got to help deliver many beautiful babies into the world. I have worked dermatology, and currently I work cosmetic surgery. So my perspective is a little unique, whereas I can kind of talk to you guys from a work standpoint, but also from a personal standpoint because I've been there and I'm going through it now. I wanted to make sure to include that. I decided to have cosmetic surgery because I didn't feel like a woman and I wasn't thrilled with my weight loss. Like I was, don't get me wrong. It was hard work to lose 60 pounds and it's been even harder work to maintain that weight loss. When I put clothes on and when I laid down to sleep at night, I didn't feel like a girl. My breasts were flat and flabby, and they just were really sad. The final straw, what broke the camel's back, and I was like, I told my husband, who was fully supportive, I would put on a bathing suit, I leaned over to pick something up. It was a one piece. We were getting ready to go to the lake and I put my bathing suit on. I leaned over to pick up a floaty or sunblock out of the floor. When my boob fell out of my bathing suit, it looked like a testicle. I'm not trying to be funny. It is funny, but I didn't want testicles on my chest. So I made an appointment for a consult. I had one of my dearest friends. We ended up seeing the same surgeon, but was the only person that I knew in real life who had had a breast lift, and I trusted her. I still trust her, by the way. She gave me great advice. She didn't hold anything back, and she 110% recommended the surgeon that I saw. I loved him too. He did a beautiful job. I had my breasts lifted and I had implants put in to fill in the space so that it wasn't just skin, because after all that weight loss, that was basically what was there, was skin. I had a mastopexy, which is a lift, and augmentation, which is adding an implant, and I had the anchor incision, so it goes around your areola, it goes down and then underneath, and they will remove a little bit of tissue just to kind of make it an even fit, if that makes sense. That's not the procedure that everybody has to have. If you have a lift, there's multiple different surgical approaches you can take. First and foremost, you need to find a surgeon that's reputable. You need to firsthand see their work. So look at the befores and afters online. Ask to see before and afters when you go to the office. But you need to have a consult, and you need to have the surgeon that you're interested in let you know if you'd be a good candidate. So I was a good candidate. I scheduled and we went through all the steps, and because it's been 4 years, I don't want to miss out on anything. So I'm not going to hit every single point with the breast surgery. How did things go? Everything went really good. I loved my results. It was incredibly painful, to be honest with you. I did not have drains. Most people that have a breast lift have drains. It's a very common practice. Having a drain, like a JP drain, a Jackson Pratt drain, it helps to prevent seromas, which are buildup of fluid that's in the pocket. So when you have implants, your surgeon creates a pocket in your breast. Sometimes it's below the muscle, sometimes it's above the muscle, but they'll put a drain in when you have a lift to prevent a hematoma, a seroma, which is a buildup of fluid that you don't want. It can be incredibly painful. Drains aren't pleasant, but they do serve an important purpose. But you need to find somebody that you trust to do your procedure. I can't stress that enough or emphasize that enough. How much time did I take off work? For my breast surgery, I took 9 days off work, and that included 2 weekends. It really didn't feel like it was much. If I could turn back time, I should have taken 2 full weeks off. I was 8 weeks post-op when I finally felt good. I didn't have to take pain medicine, but except maybe the first few days, but it was quite painful. You don't realize my implants were under my muscle, so you don't realize how much you use your chest to pick yourself up, to open a bottle of soda. You know, just doing that, it would send twinges of pain through my whole body. It was rough, but if I had it to do over again, I would absolutely do it again in a heartbeat. I didn't get implants so big that I felt it would be super obvious to everybody who looked at me. I wanted to just be proportionate and to feel like a girl again. So I'm gonna tell you the size of implants that I got, but remember that I'm 5'10". I'm not a short, I'm not a petite, small framed woman. I am tall. Implants look different on everybody. You gotta remember that. My implants are 445 cc's, and I have an SRM, if you guys know anything about implants, and it's a silicone gummy. Do I have any future procedures coming up? Yes, I do. Back when I had my breast surgery, it wasn't on my radar to have the lipoabdominoplasty done, although my surgeon at the time said, you'd be a great candidate for this. It wasn't something that I was like, yeah, sign me up. That's what I want to do next. No. In all honesty, I see patients all the time that have their breasts done one day and their tummy tuck another day. And y'all, I don't know how you do that. You braver and more woman than I am, because it's a lot. For me, having both done back to back, or heck, even in the same year, was too much. Like, I'm thankful that I did one at a time. Today is Sunday, July 25th, and on Thursday, July 29th, I will be having a lipoabdominoplasty, and that will complete my mommy makeover. Lipoabdominoplasty is a long word. What does that mean? So it's not just a tummy tuck. A tummy tuck is where they will remove excess skin from your lower half. Lipo is liposuction. So I'm going to have a significant amount of liposuction to contour and give a nice shape to my frame. They're going to liposuction. Let me stand up just a minute. So they will liposuction here, here, and here. And that will help give a nice shape. The abdominoplasty is when they will remove the excess skin. So you can't lose 60 pounds and not have something to show for it. Marks of pride. I don't hate the skin, but To be honest, it is not super cool to have to tuck yourself into your clothing. If you know, you know. Hi. Isn't she so cute? Okay, moving on. I'm gonna have a tummy tuck and I'm really excited about it. If you guys are interested, drop a comment below and leave me a stethoscope in the comments. I want to know if you guys want me to vlog my post-op so that I can kind of give you raw how I'm feeling. If you think that that would be helpful, I would like to know. I would like to know if this video is helpful in any way to you. Please talk to me in the comments. Talking about the lipoabdominoplasty, the planning stage, I had talked to my husband and he knew that it was something I was interested in. But I guess 3 to 4 months ago when we were getting back from our Disney World vacation, I talked to him and he was like, why don't you plan a consult? And I was like, I don't know. And he was like, just do it. This is something you've worked your butt off for, like literally. Make a consultation and I'll go with you and we'll see what can be done if you'd be a good candidate. I had a consult and was told that I'd be a great candidate, that my procedure would be mostly skin removal. I am also going to have a revision done on my right breast. When you have breast surgery and you have implants, the implants are put into a pocket. So your surgeon makes a pocket either under your muscle or above the muscle. Mine are under the muscle. My left breast is the perfect shape in my opinion. It's round and it looks like a normal breast. My right breast, however, looks like a SpongeBob square boob. I know that's weird, but it is what it is. One side is kind of flat where my pocket wasn't expanded all the way. While I have my tummy tuck done, my doctor is going to do a revision on the breast and expand that pocket so that the implant sits a little bit better. The goal is to hopefully not damage the implant or have anything happen to it so that the implant that I have in currently can go back in. But there is a spare just in case anything should happen. Emotionally, if you guys are thinking about cosmetic surgery, I think that you should, number one, have an appreciation for the body that you have currently without cosmetic surgery. There was a time that I thought anything cosmetic was vain. I thought injectables like Botox and fillers, I thought, oh, the vanity people must feel to want to have those done. And then as I matured and I got older, I realized, you know what? It's not a vanity thing. You can call it that if you want to, but my perspective has changed. I feel like if it makes somebody feel good and feel confident in the skin that they're in, I don't see a problem with it. I think it's great. I think men and women should take care of themselves. And if that's getting a little Botox every few months, get you some Botox. If it's having cosmetic surgery after you've had an extensive weight loss, do it. Be proud of yourself. While it's important to love the skin you're in, I understand when you don't fully love it. If you're willing to go through some discomfort and pay, because it's costly, good for you. I'm proud of you, you guys. It takes a lot of courage to share this information and to put it out there hoping to help others. So I hope that that's what this has done. I hope that I don't sound like I'm all over the place, because I'm not trying to be, but I just have a lot to say while I'm talking about the tummy tuck. You guys know to drop an emoji in the comments below if you want to see more, if you want to know how I'm doing in my recovery days. I would love to share that with you. Let me know. If you haven't already done so, please hit the subscribe button. Make my channel grow, help my channel grow, be a part of the YouTube family. So while I was thinking about it, I wanted to share something else that I thought was really important for you, especially if you are planning on having cosmetic surgery. Not only do you need to do your research, find a good surgeon that you trust, you also need to educate yourself on what the procedure consists of. I know that not everybody is made for working in the OR, but being realistic, you should know what the surgery entails. Do your research. Can't emphasize that enough, but you also need to have a support system. My husband will be my caregiver, and he will drive me to and from my post-op appointments. He will help change my drains and my dressings and my compression garments. I will also depend on him to take care of our girls in our home. The recovery for this is about 2 weeks, and that's how much work I will be taking off. Anyways, I just wanted to make sure that I included that. Also, while I'm thinking about it, since my surgery's coming up, I thought that I would share my supplies with you, the ones that my doctor required that I hope might help you if you are considering having cosmetic surgery, a lipoabdominoplasty. This is what my doctor recommends and some things that I recommend. First of all, I'll go over the medications that my doctor's prescribed. So I will start the day before surgery taking an antibiotic. I will start the antibiotic and I will take it until I am finished with it. And I believe he does like a 2-week course of antibiotics. And then the night before surgery, I'll take a lorazepam. That's a Valium, and that will help ease any anxiety, help me to get a good night's sleep. And then the morning of surgery, I will take another lorazepam to keep me nice and chill when I go into the OR. The doctor has prescribed Norco 5s, and that is hydrocodone, and it will help with pain. And then also when they give antibiotics, when you have anesthesia, when you take pain medicine, there's always the risk that you could have some nausea. And he has also prescribed Zofran. So I have Zofran to take if I need it. And those are kind of my pre-op meds, and then the day of, and you know, my post-op. But then one day post-op, my doctor will give me a shot of Lovenox. Lovenox is a blood thinner, and it will help prevent any blood clots. Now that you know the medicines, no NSAIDs after surgery because they can increase your risk for bleeding. So I've got some Tylenol. It's just Equate brand. To combat the anesthesia medication and the pain medication, we all know pooping is important. You need to have a bowel movement. So this Equate stool softener, it's like Colace but generic, is great, and I will start taking that probably the evening after surgery just because we all needs to poop. Here I'm getting into my surgical supplies. So the liposuction, the way that my surgeon performs the surgery, I will have tumescent infiltrated through my body through different little liposuction ports. So they'll make a tiny little cut and then put this fluid that has a numbing agent in it throughout my whole torso, my flanks, and then on my back. That fluid, what goes in must come out. So my body will absorb some of it, but then some of it will also leak out into my JP drains, my Jackson Pratt drains, and then some through the liposuction sites. So they will put a little suture in there to close up the liposuction sites, but I will use these, which we kindly refer to as chucks because you chuck them when they're messy. It's like a puppy pad, but I will put that up next to my skin and underneath my compression garments. So I will have 2 compression garments. One will be like Spanx, and it starts at my thighs and will go up to just under my bust, and it will hook an eye up the sides, and then a big long zipper. Hook an eye like a bra, so it'll hook like this, and then you'll zip it up. So it's like a big girdle. And then I'll have a 3 flap abdominal binder, and it'll go like zoom, 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 and it'll just compress right here. Those are coming. They already have those set aside for me. So I'm also going to use these. Thank you, Walmart. Shout out Walmart for all these supplies. These are sterile gauze 4x4s. We will use these for drain sponges and over my belly button scar for my new belly button and then my old belly button. You're only given one belly button, the one you're born with, and mine will have to be relocated, so I'll have the same belly button in a new spot. That's why we call it the new and the old. The old one will have to be stitched up. It'll either be a little horizontal or a vertical incision on my lower abdomen. But you know what? That's the price that you pay to have a cute belly button. And I'm pumped to have a new one. So we'll use the gauze for the drain sponges and the drain sites. And we'll hold it together with some paper tape. Paper tape is easier on your skin than silk tape, so we're going to use that. My doctor prefers this bacitracin ointment, and we will use that on the drain sponges. We're all about preventing infection, and that is what we will use. Then once we are not using the chucks anymore, we will use these hang on, how about I turn it the right way? We'll use these little dot band-aids to cover up all the liposuction spots. And then I forgot to show you this. Shout out to Big Daddy for getting this little bottle of Hibiclens. Hibiclens is an antiseptic skin soap. So sometimes we use it in the OR. What I'm using this for is to wash my body the night before surgery, and I also take a shower the morning of surgery with this bad boy. Doesn't smell, it's just kind of a hospital clean, if that makes sense to anybody. But I'm gonna use that to clean my skin before surgery. And then this is what I wanted to share that might not be on everybody's surgical checklist. If you're a mom and you have saved this bad boy from when you had your babies, it's like your little squirt bottle. I would recommend this. Even though I haven't had the surgery yet, I think this is a smart thing to use. If you've made it to the end of this video, thank you. I hope that you found this informative, and I hope that you guys will send up some prayers and good vibes. I'm really excited about my surgery. I am a bit anxious about the unknown and what I'm gonna feel like after. All in all, I'm excited, and I'm really proud that I get to do this. Thank you so much for taking the time to watch. I hope that you will subscribe and join my YouTube family. Make sure to talk to me in the comments. Leave a stethoscope emoji so that I can thank you for spending time with me today. Don't forget to ask me any questions. I talk to everybody in the comments, and I'll talk to you too. I hope y'all have a great week. If you want me to vlog my post-op recovery, I'd be happy to. Just let me know down below. Take care. Love you. Bye.